welcome to another episode of Studio Insights. In this episode, we're doing things a little bit differently. So as you may know, we run a human-centered design approach at Belvista Studios. It's a way we design our solutions. It produces really good results for us. And what we're going to do in this episode is I've been looking at human-centered design activities, and I found a new activity that I think may add value to our process and our team. So what we're going to do, we've never used it before. We're going to test it out today. So I'm going to test it out with Kim and Victoria. It's an activity by IDEO. So it's their I'll just make sure I reference it properly. Their field guide to human-centered design. So that's where the activities come from. So shout out to IDEO, and they'll be referenced in the description below. But what it's called is conversation starters. So I don't know if either of you have heard of that activity before.
No.
But basically what it is so when you have a project goal or a problem that you need to solve, you come up with conversation starters that are relevant to that problem. So the example that was in the field guide was, say you had to you were building like a toilet, like the goal was to create like a new toilet block. Then conversation starters could be like, what would a toilet look like in 1,000 years? What would be the toilet of the future? What would be the most environmentally friendly toilet? And you use those conversation starters with the end users so that you can pick their brain and start to get insights around what would work for them as the people that you're designing for. Does that make sense the way I've described it?
Yeah, you're getting me to think differently out of my world by using a prompt.
Yeah, that's it. Yeah. And come
cool.
up with ideas from the user perspective. So you would run this activity with the people that you're designing for. So your learners.
Okay.
So
what are we going to learn?
I'm going to share my screen. So I thought we'd do an example on the healthcare system.
Yeah.
So something that our team's really passionate about. We want to make a difference to the healthcare industry. So what I'm going to do is I'm going to pretend that you two are healthcare workers. So you're a client that we're working for. You could be nurses, doctors, and I'm going to give you some conversation starters. And I just want you both to give me the first thing that comes to your mind. So any idea or anything that you think of. And I'm just going to record it on these sticky notes.
Okay.
Yeah. So for anyone watching or listening, the intent of this is for me to understand Kim and Victoria's world as our end users and get some ideas for how we could solve a problem. So the first one is, the problem is we want to improve a practice.
Mm-hmm.
So improve a medical center or a practice and make it better. So the first one is, what would a hospital or practice look like in 1,000 years? Shout it out.
I think you just literally the front door. I don't even know if you need to go there. It might just happen at home, but it's this scanner, and it just scans your body and tells you these are all the problems, and just gives you automatically here's the solutions, whether it's exercises, medication, and it puts a plan in, and it already orders everything, and it's on its way to your house.
Oh,
so it's super automated, and it can just tell by scanning your body.
That is so cool. I think you may have just predicted the future, Kim.
Maybe. Well, we have this video. We won't maybe not be around, but depends on how my healthcare goes.
So that's really cool. I'm going to jump in and out of the role play so we can reflect on the activity.
Yeah, okay, cool.
But that's really cool because whilst you might not be able to replicate that exactly, you can get some insight into what they would want. So actually you're more like a patient in this instance for this one. So it would be what does the patient want? And it could also be insight from the employees of what would make their practice better. But it's cool because it's okay, so potentially people want their medications sent to their house rather than having to pick it up. So something like that could be actioned now, even if the whole solution is not for what's possible. So I think that's quite cool.
Yeah, even from that, there's so many different things. Like it might mean that doctors no longer exist because it's all automated. We can just go, if this little thing shows up in a scan, then it's this, and then this is what you need to do. So doctors could become redundant in the future. And as you say, how can you automate the process so that something gets sent to someone's house, and that's a system, and how do you collect that? So already just from one solution, there's like so many different roads that it could go through.
Yeah, that's really cool.
Okay, so practice look like in 1,000 years. I think it even could just be like it's like you scan, like a scan of on your phone, and it does that same thing. So you don't have to go anywhere. Practice. 1,000 years. I even think, probably in 1,000 years, you could just think it. We might have microchips in us that you just go, and maybe you don't even know, like I feel off, but like your microchip can pick up some sensation or some abnormality in your body, and it does all this behind the scenes. So maybe practices don't exist.
This is like Elon Musk level ideas.
Sounds like his job's easy, just coming up with these little this question, and then that's how he goes with his crazy ideas.
Do you have anything, Vic?
Not yet.
Okay, now I'm just stuck on similar variations of that.
Cool. I think we move on then if you don't have anything, Vic. Okay, so the next one is a hospital or practice with no limits on time and money.
Ooh. So that is definitely the medical practitioner spending the adequate amount of time to understand the true problem and come up with a solution that solves the true problem, because they wouldn't be worried about getting them in and out in that 15-minute time slot and getting paid by how many people they see in a day. There'd be more practitioners, like, because if at the moment it's about like, they'd be just able to have more GPs and more nurses available, and there wouldn't be a shortage of beds and appointments and stuff like that. So there'd be enough resources to support the demand of the world.
Very cool. I can see this leading into, you know, the how might we questions.
Yeah.
Like, how might we have, like, how might we enable practitioners to spend more time with their patients to understand the true problem, and then coming up with solutions from there. This is cool. I can see value in this. Anything else, or should we move on to the next one?
I'll give us a moment. Give us a moment.
Speed it up. We haven't got all.
Practice with no limits on time and money. Oh, well, I think a lot of I feel like a lot of people that get into this kind of industry want to help people. So it would allow them, their motivation would be super high and they wouldn't be fatigued by their job. And that motivation of why they got into the industry and sought this as a career in the first place would then follow through into how they treat their patients and how they interact and all that kind of stuff. So I think that would be really nice. Instead of, I guess, not as much empathy or poor communication or all those little things that we may experience now, because there are time and money pressures. I wonder about the balance of who would choose to do an appointment as a patient, who would go for appointments and who wouldn't. Because I think I've heard stories, and, you know, in an emergency department, a lot of people may show up because it's free as opposed to booking a doctor's appointment. But do they need to be in the emergency department?
Yeah.
So I'm not sure. That would be something to explore about what would it mean for what kinds of appointments are booked and when are they booked and who are they booked for. So that might really change what it looks like as well.
Yeah, definitely. Anything else?
Well, maybe it seems to, no, hold on. Who are we now? We're a practitioner. Are we in the industry or we're a patient?
I feel like you could be either while we're practicing this.
Okay.
What do you think? What do you think would be more valuable for solving, like,
I think
creating-
both perspectives are useful to like understand the context.
So I guess if we ran a workshop with a client, we would have both, right? We could have the
Yeah.
employees and the end users. Yeah.
Yeah. Because we'd probably have two personas.
Mm.
Well, it depends on the success statement. That would determine what perspective.
Yeah.
Don't know, Hannah.
Yep, all good. We'll do a couple more, I think. 2 more, if that's okay.
Yeah, cool.
This is our thing. A human design hospital or practice. What would that look like?
Practitioners that know how to solve the right problem, whether that's asking the right questions, breaking from their tradition and the way they've always done things to solve the true problem that each individual patient is facing. They would see their patient as a human and not just another something that comes through the door.
Not just another number.
Yeah. That's speaking from my own customer experience.
Yeah.
I believe that there would be more social responsibility playing out. And what that might look like is education in schools around mindset and well-being and that kind of stuff, self-worth, love, all those things that when they're not nurtured in the child, then stem into something as an adult. So helping in the education system, their social responsibility is to have like classes in school that focus on well-being and self-worth and self-love. And then also their social responsibility to do that for parents to support that in the home as well. So parents are better equipped to help with the mindset and not create trauma experiences that then grow into illnesses or life choices down the line that lead to people in our current state of the world, or in Australia, maybe even just of why people go to a hospital or a practice in the first place.
Yeah. That's really cool. I'm going to jump in as well. I think like if options were provided to the patient for how they could heal themselves. Like it's not just like a one thing fits everyone. It might be like you can try like natural remedies, or you can do this medication. So it's more like of a holistic thing.
Yeah. Yeah, because right now it is one person's like knowledge or extent or beliefs, and then like we don't always go and seek that second or third opinion on our diagnosis because we're like, well, that's more money for an appointment.
Yeah, exactly.
Yeah, I guess it would be a better understanding of the barriers that exist for the challenges that we're facing. And challenges, I would say, will come from data such as deaths, types of illnesses that exist wherever it is. And then we'd be out with a human-centered approach, you'd be able to solve them.
I don't know if they do this already, but I think it'd be cool if they had some sort of like record of you and your life. Like I can imagine you like walking into the practice and they're like, oh, hey, Hannah, like, how have you been since like that family member passed? Like, I'm really sorry about that. Like you've been attending your psychology sessions, like how have they been going? And just having like, they know about you as a
life
human.
diary, basically.
Yeah.
Yeah.
Anything else for this one?
No, I think it's broad enough up, probably for the demonstration of your activity.
Cool. All right, let's do one more, I think. Whoops. So a hospital or practice that prolongs the lifespan of everyone.
Ooh. My immediate response is some of the ones that we said in the human-centered approach definitely carry over to this one.
Yep.
But prolongs the lifespan.
I think that scan you said, like scans the body as you enter.
Yeah.
Because then it can pick up on things that the doctor or the patient might not know.
Yeah. So right now, just to recap the intention, because I feel like I want to remember what we're here to do. So it's basically how might a hospital or practice prolong the lifespan of everyone?
Yeah.
That's what you want ideas for? Okay.
Yeah.
Yeah, not accepting stats. So like the expected life expectancy is this, or you have this diagnosis, your life expectancy is this. What if that is a limiting belief or has some, like, because it just goes to anything I've heard about the placebo, where like you can heal yourself by being on like is that the placebo effect, where it's like you have a pill and it's actually doing nothing, but you improve something. So what if we are limiting ourselves? So what if we treated everyone like they were going to live forever? I think it definitely comes back for me, like education around mindset in schools and for parents. And maybe that comes down to helping people decide, should they be parents? Like we have to get a license to drive a car and get, like, you go to marriage counseling or not. What is it? Like pre-marriage something. I don't know what that is called, but like there's lots of things that you do something to be able to be qualified as proficient in that. Or maybe parenthood is a conversation that we should be having. Is this right for you? Why do you want to have kids? What if we just like, I guess I don't know enough about it, and so I don't want it to come from a place of huge assumption, but like there is, to the limited knowledge I have around, you know, what if governments just eliminated all bad foods, all processed foods? Like it's money driven. That's why these things exist, and it gives money to someone, power. So what if a government just said, no more of that? We know that that kills this, or we know that that causes this. We want our humans to live forever in our world, so therefore no more. And that money, that power just ceases to exist. So it's standing up to stop those things. Like, for example, if, well, I don't know the stats of smoking, but like they always say smoking's bad. So, you know, we'll just fucking, those companies can't exist anymore. And
yeah, cool. I like it.
All bad foods, all bad habits. They, I don't know. Well, our council's really good. Like I was just going to say, they offer free health stuff. Like I know, like I'm part of Brisbane City Council, and they do free yoga. Like I go to that on the weekend. Like they do free fitness classes. That stuff is available. Maybe it just needs to be better communicated. So the systems and things are in place, but maybe it's awareness that they exist for people, because not everyone knows that there's free yoga, there's free Tai Chi, or there's free boxing on a Saturday in the local park.
Yeah, that's cool.
Provided by your local community. So, yeah.
Very cool.
Better exposing the good things that exist, I guess.
Yeah.
So that people take advantage of it, but then that's probably a challenge that we need to understand better. I don't know what that currently is, but why aren't people taking advantage of that? It probably goes back to mindset on like delayed gratification. You know, we keep eating shite and it only impacts us when we're 50. Well, if that's like 20, 30 years away, I might not make it then anyway. So I'm making immediate life choices. So maybe trying to think, I guess that's critical thinking and strategic thinking on your life. Maybe that's a skill we need to learn, because then I, as a person, might think, you know, these Big Macs that I've been having for the last 10 years, like, yeah, they're probably going to play out somehow down the line, but I don't know what that is. So maybe being able to think about that a bit more and go, oh, do I want to be, I don't know, unable when I'm older? Do I still want to be able to surf and do all these fun things that I can do now when I'm 90? Maybe that is possible for me if I make these choices now at the current age that I am.
Yeah, that's cool.
Okay, I think I've done enough for you.
Awesome. Well, I think we'll finish it up there just for the purpose of the demonstration.
Yeah.
I guess, what reflections have you both had from that activity? Do you think it's something that we could use with our clients to help come up with ideas and solutions for improving their service?
Yes, I definitely see it playing out for, sometimes I feel like people can't get out of their own world. So to empathize better, it is good. Like that, how might we do this? It puts yourself out of your own experience of the world. Like there was definitely certain things that were coming up for me that were based on my experience. But then the way you gave us prompts allowed me to think of it from different frames, a different frame of mind. So that was helpful.
Yeah, I feel like to me, it kind of seems like an extension of empathy mapping. Like, but the prompts helped you think of it in a different way, because I know with that it's like, what would you hear, say, feel, or think? Is it do? Okay. But I feel like those questions, it just like kind of takes it to like the next level and helps you expand on it a bit more, because it does make you think of it from like a different lens to where you might be stuck.
Yeah, that's
definitely
cool.
that the first one, the 1,000 years, like, and I know we have a resource where it's like, yeah, like the next one, no time limit, no time budget limit. It gets you into a frame of mind as the participant in your activity of possibility. So it didn't have me, maybe the lower ones actually now, just on reflection, they made me think of my current experience and it's hard to change, or we're not going to be able to overcome that, which I think sometimes can play out. And it's like, oh, it's all doom and gloom. But those ones got me into a place of possibility. So you can see that's where I'm like, in space, like science, like all this technology, whereas the other ones are like, oh, I don't know, maybe. But I think it does allow that possibility, openness to this solution can be solved.
Yeah, it's very cool. I think as well, like, it's awesome that even though some of the ideas were out there, I can imagine if there was like employees and patients in the room, employees could be like, oh, we can't do that, but we could do this. Like, we could do a lower scale version of that. And the patient could be like, oh, that'd be so cool. Like, that's the ultimate. But if you can achieve it in another way, that would be awesome. So I can just see like it would bring up opportunities for improvement. And I'm wondering if, yeah, like at the end of the process, like people would like look through them and be like, what would actually be possible? Like, how could we make some of these out there ideas a smaller scale so we can actually do something with it?
Yeah.
But yeah, I think it's a really cool activity. I like it.
So how would you think about your next steps? You would do this before you storyboard, like you're still in the analysis phase. So how would you use what you've got from us to solve the problem?
I'm more currently, like, I'll reflect on it more, but I'm seeing it when we connect with the healthcare providers. So this is an example where we do human-centered design and then we generate a report that provides them with strategies to improve their practice. I can see like these ideas, once they're put into like a more applicable format, put into that report so that clients can see like these are the things that we can change that can make what we offer or do now better. So I can probably more see it in that report. I need to reflect on how it would work for like a storyboard or a learning solution.
Yeah, I feel like for me, it's like it would be you're brainstorming really, and then you'd have to go back maybe through a voting with the people in the room.
Yeah.
And say, well, let's vote now on which ideas we want to move forward. And you'd have to have criteria around that, because some of them, like, it'd be cool. It'd be like, oh yeah, do the scanner. And it's like, well, that's $1 billion trillion idea and the technology isn't available yet. So you'd need criteria for it.
Yeah.
But it's thinking about, yeah, which ones do we want to move forward? What's our criteria for bringing an idea forward and starting to prototype that? And it's also looking at, you know, some of these things, training's not the answer, or this is a quick win of how we can achieve that, or, you know, we need to partner with schools, or we need to partner with parenting, I don't know, groups or something. Like the problem is bigger than just the healthcare industry. It impacts other industries. How do we connect them if we want to truly solve the problem? So it's giving us deeper context on what's happening. And then from that, it's like, yeah, there's lots of, I'm just looking at that one that I can see now. So practice with no limits on time and money. So as an instructional designer, I'd then go, yeah, I'd seek to understand on that first one, how can we create more time for practitioners? Like, they always seem to be on the go, rushed, under pressure, time pressure. I would want to dig deeper and understand that. Why is it that way? What are all the challenges? That definitely needs to be resolved on a deeper level. And then there'd be so many things in terms of processes, culture, technology efficiencies that would come out as a solution. The next one, more practitioners have the support. So more practitioners, yeah, like maybe that's a thing where we have to go, look, there's not enough practitioners to support our population. Hey, government, like instead of, I don't know, the potholes this year, put that money into creating more job opportunities in this industry. So refocusing where they prioritize their money.
Yeah.
And might that look like, I always thought this was a cool idea, and I'm trying to like see how it plays out. But you know, like in the conversation with the government, what that could look like is, well, what if we all pay taxes? What if at the time of tax you had a little pie chart and the government said, these are all the things that we spend our money on. You as a citizen, Kim, where do you want to put your money towards? And because I care about healthcare and I care about education, then I might say 50% to those things, and then everything else is just getting like 3%, 2%, 5%. And that's how government decisions are driven by the people, as opposed to what the priorities and how they're set now. So we just see how that is like it's like the iceberg, that systems thinking. Because if we have a generation like us that care, well, I don't know, that's a big assumption, but like if I just think, because I recently watched I Am Greta, that climate change documentary. So if there's a significant increase in the future generations caring about climate change, well, then we should be listening to the people that are going to live in that time that we're making decisions about now. What do they care about? How do we start being proactive towards solving those problems for the life that they're going to live and the world that they're going to live in, not the world that we currently live in for a pothole that's out there that we could just drive around. I know that's a very basic thing, but that's how, I guess, we use, when we talk about solving the true problem, this is how it could play out. And that's how we also become very valuable in terms of us as instructional designers, because these are the problems that we actually solve. Like if we really did our job properly, these are the conversations we'd be having and trying to influence, and the initiatives that we'd be working on, which people are doing. And that's all like the big design thinking and human-centered design firms, that's the problems they're solving.
Yeah, wow, that's cool. I can almost see it as like it's on, what comes out of this could be like on a graph thing where it's like, these are quick wins you can do. These are like systems level problems, like wicked problems. These are like, this could be a training solution. Like we recommend, like it's a skills thing that people need, and like separating it into those sections so that people can understand what they can do with it. Interesting. Cool. Well, that was awesome. Thanks for participating, team.
Oh, good. So this was basically, you had discovered something, you wanted to experiment with it and see if it might improve how we do things or how you do things as a practitioner. So like, that's what we're just learning to be better and serve our learners better. You're just seeing it play out live. So definitely y'all need to be doing it.
Awesome. Thanks everyone for tuning in.
What's up, awesome human? Thank you on behalf of myself and the Belvista Studios team for continuously choosing to learn with us. We really appreciate it. If the tips and the insights and the context resonate with you and you want to take your skills to the next level, or you want to make your life way easier, you will love our Creator Hub. The Creator Hub is a place for people like you and us. Basically, it's the stuff that we use internally at Belvista Studios, and then we just share it publicly with you. The Creator Hub is created by instructional designers for instructional designers, and what you'll love there at the moment is we've got a quiz, Could I Be a Better Instructional Designer?, that has so much tips in the feedback if you're interested in human-centered design or just taking your skills to the next level in terms of the solutions you're creating and the problems you want to solve. But in there as well, aren't we cute? That's us. But we've got the coaching courses, freebies, give us gratitude, and also we've got some templates. And basically they're always around the lens of learning experience design, instructional design, and e-learning. So a human-centered design focus is very much what we're about at Belvista Studios. So putting your learners at the heart of a solution and creating something for their needs. So there's the human-centered design stuff, and then we've also got the business stuff. So this is the stuff they don't teach you about when you want to become a freelancer or a consultant in the instructional design world. So go check it out. The link is in the description. You can check out everything that is available for you. Thank you for choosing to learn with us. Continuously invest in your skills. You will be rewarded as an instructional designer. Share this stuff, share it with other people, because when we are better instructional designers, we create better solutions that create better humans, that create a better world. So we have a very important role, and I'm excited to be on this journey with you. Have an awesome day.